Hi YouTube, this is Kara again, and welcome to my channel, Fat Girl to Slim Girl. First I wanted to apologize because I just watched my last video, to recap on what I'd been telling you, and I realized it froze in some places, and the sound wasn't that great. Yeah, sorry, my laptop is kind of crappy. But now I'm using my mom's PC, so hopefully the video will be better this time. Anyway, so I wanted to give an update on what had been happening. Last time I was with you, I told you that I had set up the appointment to see the bariatric surgeon, Dr. Rivera. So, I did. I had my consultation with him, and it went really well. When I went in, the first thing that they did was they took me to a back room where a nurse took my blood pressure, weighed me, and did some other tests. They had me stand on this machine, and I guess it tells your body composition, how much is water, how much is fat, and all that. And then they break it down to how much extra weight you have, how much excess weight you have, and approximately how that excess weight is distributed. So for example, here's the paper. So for me, they said that my body fat displacement, my torso, is pretty much 107.8 pounds. My legs, right and left, are 21.5 pounds, respectively. The right arm is 10.7, and same with the left arm. So, yeah, so that's how it went down. And, I tell you your total body water mass and all of that. So, for me, the composition of water was normal for me. Apparently, my body is composed of 39.5% water, and 40 to 60% is considered normal. So, I'm just a little under normal, I suppose. Yeah, so that's how it went. Oh, yeah, and they calculated my resting metabolism as well. So, after that, I waited in the office for a little bit, and then I was taken to another room where I sat and waited for the doctor to come in. So, when the doctor arrived, he spoke to me about the procedures. I did bring my mother with me. I would suggest to other people too, if you have someone who supports you on your journey, you can bring them along, or you should bring them along, so that you're not by yourself and dealing with all of this. So, he asked me a couple of questions about myself and about my eating habits, and why I think I got so overweight, and just all of that. So, you're chatting, and, Mom kind of dominated some of the conversation, I'm not gonna lie, but, I was a little embarrassed by some of the things she was saying, but, at one point she was claiming that I hid food, which is not true, but, I don't know, it's kind of weird. So, I was just kind of embarrassed at that point. But I guess our parents are there to embarrass us. But anyway, So the doctor was talking to me about a few of the surgeries. I guess ones he does are gastric bypass, vertical sleeve, and lap band. So for me, he did suggest gastric bypass and vertical sleeve, but I think he was trying to push those two more. But I said that I was not comfortable with that, and I really wanted to try the lap band. And of course, he told me that, doing the lap band, you have to be extremely dedicated to, of course, changing your lifestyle. Not that you don't have to be with the other two, but, because of the gastric bypass has the malabsorption effect, so you're not absorbing as much of fat and, nutrients as you normally would, so you will tend to lose weight. And of course, with the vertical sleeve, you're cutting down, your stomach, so it's smaller, but you leave the intestines intact, but you only get a small amount of food in. So, there was that. But, I said that I felt that the lap band was better for me. So the doctor said, alright, and, I did ask him a couple of questions, which I do want to go over, because I think this is important for other people just starting the journey to think about what you're going to ask the doctor in your initial consult. So I will read the questions that I asked my doctor. Alright, I have them written down. I have a notebook here where I write some stuff about, my weight loss journey, just to have it written down, stuff that I think about. Anyway, so the first question I asked was, how long have you been a surgeon? Are you certified by the American College of Surgeons? Are you a fellow of ACS, an American College of Surgeons? Are you a member of the American Society for Metabolic and Bariatric Surgery? Is your program accredited by ACS and ASMBS? How many gastric band surgeries have you performed? If you're on vertical sleeve or gastric bypass, you can tailor these questions to fit what you want done. How many have you performed? How many gastric band surgeries do you perform per month? Just see what the traffic is like in that practice. I think if you're a good surgeon, you'll have a good amount of traffic. If you're a bad surgeon, you probably won't. So, I also asked, do you use both the lap band and the realized band? Are the majority of your procedures performed laparoscopically? So, for some of you who might have been researching, the two ways they do these surgeries are laparoscopically and open surgery. So open surgery would be the one long incision. Okay, I also asked, what percentage of procedures are planned to be done laparoscopically but are converted to open surgery? Let me see. I'm actually running out of time here, so I'm going to continue on in part 2. Okay? So see you in part 2, guys. Bye.